1:30. We're going to go ahead and start our CDBG Citizens Advisory Committee meeting, November 20th, 2024. And at this time, any cell phones, if you'll please put them on vibrator or off, we'll get started. And I'm probably the worst offender, so if mine goes off. I'd like roll call, and we'll start down at your end, if you would, Jim.
Jim Howell, present.
Ginger Cutting, present.
Janie Evans, present.
Debbie Savoini, present.
And Marianne Settles, chair. So what I'd like first, if we can approve the minutes from the September 18th, 2024 CDBG Citizens Committee meeting. I need a motion if everybody has read those.
Madam Chair, I move to approve the minutes from the last meeting.
Thank you, Ginger. I need a second.
And I second the motion, Jim Howell.
Thank you, Jim. All right, with that done, I think we're going to turn this meeting over to you for a while. Mike?
Yes, ma'am. Michael McInnes, Community Development. I'm your CDBG coordinator here with the City of Prescott. Today is our community needs workshop. So we have a lot of stakeholders from the community here, share who they are, the organizations which they represent, and let the committee know what needs are happening or need to be addressed in the community. So it also is a critical year because we're going into our 5-year consolidated plan. I shared this pie chart with the committee in our last meeting, kind of show you where we're at. We're conducting community outreach. This community needs workshop will work as a public hearing. It's required within our citizen participation plan as well as HUD, and it's going to help us create that 5-year plan, the goals and strategies. Today for the committee, again, this is a public hearing required by our citizen participation plan. There was a public notice posted over 15 days ago on the Daily Courier as well as the city's social media platforms. This is the opportunity, again, to hear directly from community stakeholders regarding issues and needs affecting Prescott's low and moderate income residents, or LMI, and please feel free to ask questions of the stakeholders after they complete their presentations. You don't have to ask all the questions again. If there's questions you feel we don't get to, just give them to me and I'll get with the organization later for the sake of time, probably. Okay. In the past, I had a big CDBG presentation. This year, not so much the case, but I do want to give everyone a summary of what CDBG is. What it stands for is Community Development Block Grant. It is a HUD program which the City of Prescott utilizes. We've been utilizing it since, I think, 2003. And it is really meant to benefit, again, low and moderate income residents here in our city and in Prescott specific. I put down a list of, it's not completely comprehensive, but many of the things that we can do with CDBG money or funds here at the city. Many of these items is what we've done in the past. Housing-related projects, we have a minor home repair program here in the city in partnership with the Chamber of Commerce Foundation. Public infrastructure improvements of LMI areas, rehabilitation of community centers, health centers, homeless shelters, transitional shelters. We can do job training programs. We can help out with transportation services. And another one, a big one for CDBG is parks and recreational space improvements. Again, with the focus on LMI areas. Final slide, and then we'll turn it over to the gist of this meeting. And this is for the stakeholders. This is for all the organizations that did show up today. Thank you for coming out and being part of this. I know it's not everybody, but it looks like a really good turnout, really appreciated. How we're going to work this is we've broken it out as an agenda in different sectors or groups. And I'll read those groups right now. The first group will be the city departments, municipality services. That full group will come up to the table, introduce themselves, share a little bit about their organization, and then provide a concise overview of their community needs and the trends that they see where they're sitting in their department or organization. Each presentation, please limit to 3 to 5 minutes if you can. You know, I know that's a short amount of time, but we want to allow opportunity for the committee to ask questions, and we really are just here for about an hour and a half. And then the last thing, again, as I stated, information shared today will be recorded and included within our city's upcoming 5-year consolidated plan. So back to the agenda. First group is the municipality services, public works, community development, and parks and rec. If you guys could come up to the table here. The next group after municipality services are housing and shelter services. Then we have groups that are focused on basic needs and senior services. And the last section is other public and health services, okay? And I'll try to call you up by organization as we get into each group so you know when you're supposed to come up. So with that, if y'all would like to go down the table, introduce yourselves, what organization that you're with, and then you can start your presentation, so.
Hello, my name's Elise Anderson, and I'm the Stormwater Specialist at City of Prescott Public Works.
I'm Jeremy Cordova. I'm the Public Works Environmental Project Manager.
Randy Parham, City Engineer, Public Works.
Chelsea Walton, Community Development Director, and I'm here on behalf of our Neighborhood Services Division.
Yeah, go ahead and just go into y'all's presentation, I think.
Great. So the three of us from Public Works here, we're here today to present the Dexter Neighborhood Drainage Improvement projects. And so we'll begin just by briefly defining Dexter Neighborhood, giving an overview of the historic flooding in that area and the need in that area for infrastructure improvement. And we'll conclude with some potential projects as next steps. So Dexter is comprised of the 2 census tract block groups. It covers roughly half square miles in the heart of downtown Prescott, bounded on the west by Miller Valley, the north by Whipple, the east by the Yavapai Prescott Indian Reservation, and the south by Sheldon Street and Miller Creek. So it's home to just under 2,000 Prescott residents, and the area has received CDBG funds in the past. So historic flooding in the Dexter neighborhood has flooded people's homes to the extent that it has entered their living rooms. With the monsoon season, water continues to flood people's properties annually. And unless they take it upon themselves to remediate problems with sandbags or other low-cost methods on a small scale, they're not finding the permanent solutions that they need to remediate their flooding problems. Of course, this is a public health hazard due to the pathogens that enter the home with the floodwaters and mold and mildew that follow. It also affects their ability to have transportation either by car, bike, foot, because some of those roads are closed and transportation is impeded. So in Public Works, we plan to use the CDBG funds to support hydrologic studies in the Dexter neighborhood to determine the most effective and beneficial drainage infrastructure project in that area for reducing flood risk and improving the residents' living conditions. It would improve the neighborhood's physical environment while subsequently improving also the health and safety of the residents who live in that neighborhood. And so with that, I'll pass it over to Randy, our city engineer, to get into the details of where we're at in the project phase currently and where we're looking to go in the future.
All right. Thank you, Elise. Yeah, so the city's already conducted some projects that have kind of set the stage for what we want to do next. In 2019, we hired Helm to do a citywide area drainage master study. And as part of that study, they actually developed a Flow2D model for our entire city. Flow2D is a flood routing model that combines hydrology and hydraulics, and it can simulate riverine flooding, alluvial fan flooding, and urban type flooding, which is what we're seeing in the Dexter neighborhood. So that project kind of gave us a foundation of really good hydraulic data that we could utilize for other projects. So one of the projects that came out of that was the FEMA Risk Map project. Some of you might be familiar that we remapped some of our floodplains in the city, which took out a lot of homes out of the floodplain, which was great. And then it also allowed us to conduct the Dexter Neighborhood Drainage DCR, or Design Concept Report. That report was completed in May of 2023. That was done by Wilson and Company and Lion Engineering as our consultants. And they were trying to identify just different drainage and flood mitigation measures for the Dexter neighborhood that were both cost effective and that the community would accept. So as part of that project, they conducted public outreach, they did community meetings, they also met with individual homeowners that were being impacted by these flooding events. So they got a lot of good data from that. They had data coming in from the city because we track different requests and different flooding issues or drainage issues that come up. They also assessed the existing drainage conditions. They looked at our inlet structures, our storm pipes, our drainage channels, and also the North Fork of the Granite Creek and the North Fork of the Miller Creek that transverse this neighborhood. So as part of the study, they took all that data and then they came up with different alternatives. They actually came up with 9 different alternatives, and those kind of fell into different categories. Some of these solutions were small regional detention basins, storm drain upsizing or running parallel pipes to the pipes we already had, channel modifications, and also improving the road section itself. The road functions as a conveyance structure, so doing some improvements on the roadway itself, and then also some LID solutions. And LID is low impact development, so they also had some ideas where maybe we could reduce the impervious area in the neighborhood, so more stormwater was actually soaking into the ground versus being conveyed. So at the end of that report, it was kind of like, you know, we've collected all this data, we've identified these solutions, and they basically said, you know, the city needs to now assess those potential projects, prioritize them, and then kind of take it to the next level of design. So while there were some design plans as part of that report, they were more like schematic plans, kind of like an aerial picture with some lines drawn, like a project could be here, a project could be here. So there weren't actually any true design documents developed from that. So that brings us to today. And what we're trying to do now is take the data we've already collected and take it to the next phase where we can kind of refine the study that we did and also assess those alternatives. We want to do some follow-up community outreach as well, and then take some of those identified projects and bring them to a 30% design plan. And so if we get to the 30% design plans, we can use those to develop cost estimates and then actually begin to plan and budget for construction projects that we can implement these solutions. So that's where we're at today.
And Chair, we can either go down the table with everybody presenting or each organization, whenever y'all want to do questions, whatever you think is best. Okay, let's go down the table if you like, Chelsea, and then once everybody's presented, we'll go to questions.
Okay, so again, Chelsea Walton, Community Development Department Director, and our Neighborhood Services Division has issued over 200 violations in the past year, and roughly 90% of those are for junk, trash, debris, weeds, etc. However, in that 200 number, we have many low to moderate income families that are in a position that doesn't either physically allow them to take care of their own property in those conditions or the financial means to to take care of their exterior property. So we give them the best service that we can, try to connect them with organizations that will help them out. But at the end of the day, they're in need of a little bit of a hand up with related to either dump fees, the cleanup fees. A lot of the people that receive notices from us are elderly, and they don't have, again, the means or the physical ability. So they need help doing the physical cleaning on their property. And we do have a lot of really great nonprofit service organizations that will help us, and we connect them. But at the end of the day, there are several monies that need to be paid out for the dump fees, for just service on the property, as well as potentially some neighborhood cleanup days. So we're presenting today to potentially have some CDBG funds to help these families in need. We also have situations where a notice of violation might be given for an exterior portion of the home that's in disrepair, or another part of the property, and those expenses vary greatly depending on what it is. And again, a lot of the people that have property that are in that state, in that condition, don't have the means to care for it on their own. So that's my spiel for today on behalf of Neighborhood Services.
Then I'm going to finish up with, I'm representing as the staff liaison the Workforce Housing Committee here at the City of Prescott. Our presenter called in sick, but I told her that I would help out here. I want to start out with the mission of our Workforce Housing Committee. Our mission is to plan and preserve workforce housing solutions to promote a healthy and vibrant community for all. Our vision is to facilitate housing solutions to attract and retain quality employees and lead to improved service delivery and quality of life for our residents and workforce. The Workforce Housing Committee has been in existence for, I think, close to 2 years now. It's been an uphill climb. And why they wanted to make sure they were heard at this needs workshop is to really state that it is, as many people know, a critical need for the city of Prescott. And CDBG, there's potential there that it could help in many ways, this problem. Some ideas or some thoughts is with mortgage or rental assistance. Others has more to do with infrastructure. If there's a workforce development that goes forward, CDBG might be able to help out there. So just to make sure that critical issue is addressed in this meeting, and solutions are constantly being looked at in all kinds of different ways. So that is it. And this group's open for questions.
I have a question to your joint projects with the drainage. What's your timeline? What are you looking at? A year, 2 years?
So yeah, we've already reached out to some of the consultants we've already worked with, and we're going to probably be meeting with them in the next month to talk about a scope of work for the next phase of this project. And then I would say it's probably going to be 6 to 8 months for the next phase of developing those plans, those 30% plans.
So with 30%, you start, and then you'll be back to ask for any other funding?
Yeah, I mean, we could come here for more funding, or there's other places that we look for funding as well to fund these drainage projects in the city. So yeah, but getting those 30% design plans will allow us to basically start making some real steps towards construction.
Ginger?
Thank you, Madam Chair. I was curious, you started this in 2019, and it's 2024. So what's been the delay for this long time?
The delay for the Dexter neighborhood specifically?
It's been 6 years since, or 5 years since, to this point. So is it just the process that you go through, or?
Yeah, so I've only been with the city a year, so I can't answer that probably as well as you'd like. But a lot of times it comes down to funding. As we get funds available, we can do these bigger studies. And the great thing about the study that was done in 2019 is it gave us that citywide modeling data. So Dexter neighborhood is not the only drainage problem area in the city. So as we kind of identify different areas in the cities where we're kind of having a lot of repeat offenders in terms of homes being impacted, people's property being washed out, we can start kind of honing in on those problem areas. And the city staff has kind of prioritized Dexter as one of the worst in the city. And because it's impacting, an area that's historically kind of lower economic, we want to kind of prioritize helping those folks first with the money that we have available. So probably the biggest delay has been funding.
One more real quick question I wanted to ask is you said that you had an opportunity to go elsewhere for funds. Have you all done that at this point?
So every year we work with the county because the county receives funds for drainage type projects. So we don't know how much we get each year, but every year we reach out to the county to see, and then they distribute funds to Prescott Valley, Prescott, and the other municipalities. And we try to get as much as we can every year. So that's a source, and there's other grant funding that we've pursued in the past. Yeah.
Jim?
Let's see, on the storm drain project, question one, how much money are you asking for? I know it's an estimate. That's question one. Number two, what other funds are you using for matching? And what other funds are available? I guess I'm asking you why you're here for CDBG.
Right.
And this would be for final design and bid preparation, or are there more consultants to follow after this?
Okay, yeah, so I'll start with your first question. So the other funding sources that we would utilize would be the county money I just mentioned. A lot of times that money gets used up really quickly. We have a number of capital projects that we're doing throughout the city, and those could be roadway improvements, utility improvements, but as we go through like a corridor, a lot of times we identify drainage problems as we're fixing a road or adding a new utility line in. And so, a $2 million roadway project might end up having like $250,000 worth of drainage improvements. So we'll apply that county money to that capital project. So that money usually gets eaten up pretty quickly in our capital program. And then we try to set some of it aside for things like this, studies, to kind of target specific drainage problems. But unfortunately, there's more projects than there is funds. So that's why we're coming to you to kind of supplement the money we're getting from the county so we can do more. For this study, I don't have the specific, when we get the scope back from the consultant, I'll know. But until then, I would say just throwing a dart, upwards from $100,000 to $200,000 for the study. But like I said, we might be able to utilize funds from CDBG and the county and just to try to get the project done. So.
Question on the neighborhood cleanup. Neighborhood cleanup question. Are any of the properties that you're seeking funds for owned and then they're rentals? So we're taking care of an owner's problems, or maybe his tenants, or there's another arrangement? Are they really the responsible individuals?
So we don't have an answer for that at this time. This would be a ask for what comes down the pipeline in the future. So at this time, we're trying to connect the people that have the need to other services, and we'll continue to do that. We're trying to be forward-looking for this coming program year. So that depends on the needs of the program and what arrangement we make with the people that need these services. They would obviously have to comply with any of the HUD standards with asking for funds. So I can't answer that question specifically because I don't have an open case that I could pull, but they would have to comply and meet the low to moderate income range and provide proof for that. So we would work with them and make sure that the need was legit, and bring it forward for Mike's review as it comes along.
And question, who would accomplish the work? City forces, or is this done by
Usually it's a
outsourcing?
third party. Yeah, we have a lot of philanthropic and very generous people that work very hard with their time. We have a lot of folks that donate labor. We work with the firemen that are off duty that help, Boy Scouts. I mean, all of these generous local organizations that put work in. So we would obviously look to utilize their services, but then there are those hard costs like city dump fees that are required, tipping fees for the large solid waste roll-off dumpsters and things like that. So we would make sure that we spend it wisely, and what volunteer we can obtain free of charge, we do that. But there comes a time that maybe there's a large appliance that needs a professional mover that needs to be paid. So we would look at if that need arose, we would probably look at hiring a professional third party, and it would not be a city personnel or volunteer at that point.
Thank you. Ginger, last question.
Last question. What are you looking for assistance?
So we've, to my knowledge, in my 6-year tenure at the city, the neighborhood services hasn't asked for any funds from this body. So I would say between $2,000 and $4,000 to start, and then we'll see how that works as the year progresses. Thank you.
Debbie?
Can you just clarify for me about Dexter area? Isn't that one of the low income areas in our city of Prescott? Doesn't that have the most need? I mean,
That's correct. It's been designated as a low to moderate income area. So when it comes to like HUD projects, unfunded projects like that, it makes it really actually pretty easy to get funding because it already has that designation. Thank you.
Janie? So if the committee has questions that you might come up with later in the presentation or tomorrow or the next day, if we can get those to Mike, he'll be able to answer all those for you. Because I think each one of these, we could spend 30 to 40 minutes.
Yeah,
with.
we could just get
So
off the break.
thank you. Mike, next.
Yes, all right. Thank you. Okay, the next group coming up is Housing and Shelter Services. That includes Minor Home Repair Program, CCJ, U.S. Vets, Catholic Charities, Agape House, Destiny House. Okay. Hopefully I didn't. I think I got everybody. If you're in the housing space. And the same as the last group, please keep your presentations short, 3 to 5 minutes. Start out with an introduction. We'll do introductions and what organization you represent, and then go back down the table sharing your presentation. And after everyone shares their presentation, will be Q&A with the committee. So do you want to start, Brian?
All right. Good afternoon, ladies. Good afternoon, sir. My name is Brian Campbell. I'm the Executive Director for U.S. Vets, and I'm also a retired Marine Corps veteran.
Good afternoon. My name is Allison Leneker. I'm the Executive Director at Coalition for Compassion and Justice.
Good afternoon. I'm Kimberly Brown with Catholic Charities Housing.
Sure.
Good afternoon, Madam Chair and committee members. I'm Sherry Heine with the Prescott Chamber Foundation.
Good afternoon. I'm Lisa Mitz. I'm the Director of Advocacy and Fundraising for Destiny House Restoration Center.
Okay. I'd like to go start with you, Brian, just what's going on with your organization and the needs that you are facing today in Prescott.
So thank you once again. Along with my colleagues, I know what you're going to hear is a lot of opportunities to help, and this is something that's very serious to all of us. For U.S. Vets, we have 72 transitional housing beds. We have 10 special needs beds for frail and elderly veterans. Totaling, if you include permanent housing, we have roughly 165 veterans that we serve daily. Last year, we served 64,000 meals, And on December 17th, we're going to break ground on a wonderful project on the VA campus that is going to house 103 permanent housing units for senior veterans. So it's a true game changer. So when I say about our community and how much I love, the support that we've had, especially from CDBG, since 2003, we've gone from the VA campus to Gurley Street, and with 52 units all the way over to 1040 Whipple Street, where we're currently at. And we have all of the units I just described, and now we're going to be able to make a huge dent in the point in time count, where roughly we have 13% of our Yavapai population of unsheltered homeless veterans. It's 13%. We do think that number is extremely low. We think it's low because it's conducted in January, and we know what the weather is like here, so it's very easy to go somewhere else where it's warmer. I say all that to say this, we really do need the assistance. When the GPD, the grant per diem rate for the VA, got dropped from roughly $166 a day per night per veteran to $68.64, that put us at a $40,000 deficit a month. So for us to fill that gap, we try to lean hard on donors and relationships that we have in the community, like yourselves. So with that being said, one big goal that we'd like to have for our 1040 Fort Whipple Street, Liberty Point, is $80,000 for security upgrades to get key card access and increase our active shooter capabilities. On top of that, as we maneuver into the Fort Whipple project, we're asking for $150,000 as we build upon that $38 million project. We're looking for an amphitheater. We have already been blessed by CDBG for appliances in the officer quarters, and we can't thank you enough for that. And we've also been extremely blessed with the dog path and a few other items that we're shooting for. But overall, if we can decrease the amount of veterans that are experiencing homelessness and have them housed, we need to do it right. We need to have supportive services. We need to have 24/7 coverage over there. We have a director of behavioral health. We need case managers. There's a lot of things that we would like to move forward with. And I just don't want to take up too much time, but I'd be honored to even give a tour if that's what you would like for the Fort Whipple project and also our Liberty Point facility. Thank you.
Hi. So Coalition for Compassion and Justice, our mission is to end and prevent homelessness. Our biggest programs as to date are our emergency shelter that houses 13 men, women, and dogs a night. We are a low barrier shelter, which means you can come in under the influence, but you cannot get under the influence while you're with us. And we are the only shelter that will accept a dog. We also currently own and operate 25 units of affordable housing here in Prescott, and then we are doubling our affordable housing stock out in Chino Valley with our Paloma Village project. As Brian said, the pit count numbers have been out, so I just wanted to share a few of those with you, and then I will hand it to my colleague and friend Casey here. So in Yavapai County last year, for the 2024 pit count, so actually it was earlier this year, we have roughly 527 individuals who are experiencing homelessness. Again, the pit count is flawed because it takes place in January. I believe that number to be very low. There's also a lot of stigma right now, especially with families who are living in their vehicles. So I do not believe that we've captured everyone. And it's right around 50-50 for folks being sheltered and unsheltered. Unsheltered could mean camping outside, sleeping in a vehicle, sleeping in a RV with no electricity or running water. Those are all considered unsheltered. According to HUD, if you are doubled up in a house, so if you have a family and the family's living with grandma and grandpa or aunt and uncle, that is also considered homeless. So we don't capture a lot of those numbers either. Since 2023, that is a 65% increase. And again, the study is flawed. Nearly half of that was here in Prescott. So half of that number, we have that half of that population is currently here in Prescott. These are not folks that have just moved here. Over half, I believe it was 68%, have lived here for 5 years or longer. So we are seeing a lot of folks falling into homelessness who were once housed. I know we heard a lot about the Dexter neighborhood and helping that neighborhood. My store is in the Dexter neighborhood. I can tell you that there are folks who are losing their housing because it is unsafe, and they can't afford to make those repairs. Also, the home repair program goes into that preventing homelessness. So when we really look at all of these things, the numbers are not going down. CCJ is the true emergency shelter. We have 13 beds. Prescott Area Shelter Services houses women and children. I believe they have 28 beds. They are also full. And then in the wintertime, Salvation Army opens up their winter warm-up shelter, and they are full every night. Prescott Valley has a very large population of folks living in their vehicles, and they don't have any services. So really, Prescott is really the hub for those services and getting people housed. At CCJ, our focus is permanent affordable housing. Half of my shelter right now is full-time employed. Some of them have 2 jobs. The other half of my shelter is over 65 and disabled. We're seeing a huge increase in senior citizens who are showing signs of dementia, and there's just no place for them to go. Permanent affordable housing doesn't always necessarily mean what everyone kind of has this idea in their head. CCJ works with all incomes, so we have a lot of working families that we get phone calls from that say, we both have good jobs, we have a couple of kids, we don't qualify for government assistance. Which means a lot of times if you are in subsidized housing, you have to choose between getting a raise or a promotion at work or your housing and your insurance. So there's a real dichotomy there. I think that the population of folks that are experiencing homelessness is changing. It's not just the rehabs kicking people out. Now they have no place to go. These are people that are in the workforce. These are folks who go to work every single day and they work hard for us. So that is my presentation. I work very, very closely with Catholic Charities. And so I'm going to hand it over to Casey.
Yeah. So I'm with Catholic Charities Housing, and we service veterans as well as pretty much anyone who's experiencing a housing instability or homelessness. And in that way, we have programs that can assist with eviction prevention as well as rapid rehousing, which is temporary housing assistance. Typically, that includes move-in costs. So we help cover those because most people do not have that kind of funding to move into a house. Even I don't. So that is a very helpful program. We have partnered in other cities with that kind of funding. So if you guys have more questions, definitely you can. I can also connect you with my managers for more of those details. But yeah, we definitely, echoing what they're saying, we are seeing a huge increase, especially with our seniors. They can't afford it. Some people are working 2 jobs. The cost of rent's gone up. A studio is over $1,000. I do rent reasonableness, which is where we compare rents to say why we're paying what we're paying to these people, and it's almost $2,000 for a 1-bedroom. Granted, these are luxury apartments, but that's the going price, and that's very, very high for our families, and especially for a senior. There's just not enough stock. And we definitely are a retirement community, and some people, and it's very hard to talk with these clients because they say, I moved here to, retire. This is going to be my forever home, and now they can't. We just actually got done getting some funding. We spent through it in 2 months. We helped over 200 families, and we spent down over $300,000. Most of that was eviction prevention. So we were able to keep a lot of these people in stable housing and get them back on their feet. Again, simply they had an unexpected cost, and that threw their budget off. With us, I'm going to come to the table and ask for $80,000 for rental assistance or eviction prevention. Those 2 are the programs we definitely need, especially here. We are seeing there's either the cost to move in or they just need help to stay in the housing they currently have.
Very good. Thank you. My name is Sherry Heine. I'm with the Minor Home Repair Program. As you all know, that program was a pilot program between the city and the Chamber Foundation. And the goal of the program is to help those that fit into a certain financial situation that is under the HUD programming, that cannot afford to do minor home repair to keep them in their homes. And we have found this program to be hugely successful as a pilot. So now I think we're off and running as a real program. And the program basically, how it works, and I have an application at my desk right now, but there's an application process, and I qualify them, make sure that they have all the proper paperwork and all of that. And then we will go out and visit the home and actually take pictures and understand the home, put together a scope of the work, and then we come back. We actually will find volunteers or contractors that can go back and do the work, and then we will go and inspect it after that. And so we can grant up to $5,000 with this program, and I think we've successfully helped over 20 folks so far. And I know that we currently have a grant at $65,000, and that, you know, right now is very good for us. And there's just a lot of need. We basically are picking up some of the things that these folks can't accommodate. They push it over to us, and we try to accommodate them. And I would say that we also do get a lot of inquiries outside of the area, because Prescott does take care of our folks, and we have these programs where other communities do not. So that's the minor home repair program. I know we've met a lot about it and talked a lot about it. Very important program, and has serviced folks very well.
Okay, so my name is Lisa, and I'm representing a foundation that my husband and I started back in 2012 in the Seattle area. We are a 501c3 and moved here to Prescott in 2021. We are now registered in the state of Arizona as a anti-human trafficking nonprofit. And just forgive me, I am a little nervous. I've never presented here before to you guys. So basically, we have a twofold mission. We bring awareness, much needed awareness and education about human trafficking, which is the fastest growing and second highest coming into the first highest crime, not just in the United States, but every state and every country in the world. In fact, here in Yavapai County, the sheriff's office actually established a separate human trafficking task force just because of the need that's happening in the last year or two. So our first mission is we provide education and awareness through free community seminars in every January, which is Human Trafficking Awareness Month. We also have a very large benefit concert and speaker event like we just had in October called Evening of Destiny, where we had people like Quang Nguyen and Congressman Eli Crane and Academy Award actress Mira Sorvino and many others share about the realities and the statistics and facts of what's happening in our backyard. The second fold mission of our organization is to provide healing and transition for survivors, specifically women 18 and over, although we are able to also offer services for teenagers through the Juvenile Justice Center program. Senior Probation Officer Vienna Welch is on our advisory board. And so we do have an office and an aftercare program on Black Drive here in Prescott, where we can offer holistic integrative therapies like CFTD, cognitive function development technique, acupuncture, nutrition, art, and music therapies. But our ultimate goal, and what I personally and a team of us on our volunteers have been working very hard, is to purchase a transition home where we can take in 4 to 6 women immediately who need that kind of help to be prepared for job interviews and job trainings and education and anything else that they need. Things like basic things we take for granted: cooking skills and personal hygiene, things that these women really need help with, as well as providing aftercare for trauma and release through all the therapies I mentioned, as well as group counseling. So since last month, we have had a big push because there is a home right now that private owners have been holding for us, but they're only holding it to the end of the year. It's in Prescott, not too far from our office. We need $300,000. We have raised $85,000 so far. And so most of our donors are private and personal individuals. Some companies I have, through a grant writer in Phoenix, applied to 2 other grants, but I won't know about that for a while. So I'm just here asking for whatever. All the needs are so important here, but if you would kindly consider that, I would be grateful.
All right, questions? Hit your button, Ginger.
Thank you, Madam Chair. I was just going to ask, so we heard from the vets the amount, and CCJ, did you have an amount that you were looking for?
So we would be working with Catholic Charities with their rental assistance.
The 80,000?
Mm-hmm.
Okay, thank you. And then, Sherry, did you have an amount that you were looking for?
65,000. Yeah.
And then the last one, you're just whatever is available, but you've got a $300,000 mark.
Yes, and we've raised 85 so far.
Curious if you are involved with the Chris Venha's event.
They actually were on our team last year and had attended for the first time one of our events, were on our volunteers, and out of being on our team, they wanted to do something. But we've been a 501c3 for 12 years and 3.5. This is all going on our 4th year here in Prescott, and I believe they just got started.
Yeah. All right.
All right, thank you very much.
Thank you very much.
Thank you.
Okay, the next group is our basic needs and senior services. This includes Meals on Wheels, the center, transportation assistance services, New Horizon, People Who Care, and Lori from Community Counts, the diaper bank. Okay, let's see. All right.
Give me just 1 minute. I have a question.
For the committee, we're going to avoid asking like specific money amounts at this phase, and just really hear them out on their needs and what. So I should have made that clear at the beginning. But all right, same as previous groups, 3 to 5 minute presentation, starting with introductions and what organizations that you represent. Start with Darlene here. Go ahead.
Good afternoon. My name's Darlene Golson, and I'm the Executive Director of New Horizons Disability Empowerment Center. Way too long of a title.
And I'm Barry DeKemper. I'm the Development Director with People Who Care.
I'm Kathy McFadden, the director of the center, our community center.
Neil Sneller, Executive Director with Prescott Meals on Wheels.
Good afternoon. I'm Lori Deutsch, and I'm the Executive Director of the Wrapped in Love Diaper Bank, which is now a nonprofit.
Okay, starting with Darlene.
Okay. So New Horizons is one of 5 independent living centers in Arizona. We serve people of all abilities and disabilities. Our mission is to keep people living independently in their chosen communities. 5 core services are info and referral, advocacy, peer support, independent living skills, transition. We also provide disability employment service as well as providing transportation for LMI. Most of our clients are aging, disabilities, low income. So our need and why I'm here today is for transportation to get residents to medical appointments, pharmacy, grocery store, all the things that we take for granted because we have our own vehicles. And the ability to get to these places is vital to be able to stay where they want to stay. In our current year funding, and we've been so lucky to get funding from CDBG almost every year, I think. In current year, we received $10,918.15, and we have already provided 360 rides traveling close to 1,600 miles. And at the rate and the use that people need, we'll have it expended by February 2025. So, I mean, it won't even get us through. And then all the government funding streams that we receive obviously are decreasing, and the needs are increasing. And we've lost just between last year and the current fiscal year, we're in $80,000 in grants and governmental funding. So our community residents need help. And we're doing our best. So we're trying to find new contracts where we might make more money with the transportation. We're applying for grants. Right now, we're applying for a grant through the Diamondbacks for $100,000. We'll see what happens. It's our first time asking. And we don't have a personal connection with them, but we're hoping. And then competition for grants has increased so much that it's difficult. And we are looking at reducing expenses too, so we're doing our very best. So thank you.
Ready?
Go ahead, yeah.
Okay. People Who Care will be 33 years old come this May, and which is a pretty long time to be around, I think, for a nonprofit, although I wish I was 33 again, but anyway, sorry. But anyway, we provide escorted transportation, a lot of things that New Horizon does. We use a volunteer network. They'll use their own vehicles to take them to essential appointments like going grocery shopping, healthcare appointments, going to the pharmacy, legal appointments and stuff like that. But primarily healthcare and grocery shopping. Those are the biggies. And then, of course, we provide, our mission is we want to keep them in their homes, living independently and safely as long as they can. So we provide a lot of non-medical support services to help them do that, like technology assistance. Most of our clients are older folks, 95% are over the age of 60, which kind of reflects the population here in Prescott. So, you know, we've got volunteers and an employee actually that goes out to their houses and teaches them how to use their personal computer, how to set up a smartphone, stuff like that, so they can, you know, access services online, which is almost a necessity nowadays, and socially, you know, communicate with families. I think over 70% of our clients live alone. So, and you know, we're a pretty mobile society now, so a lot of times family isn't nearby. But we also do things like family caregiver relief, pets to vets, minor home safety inspections or assessments, and repairs, which is a big one. We started a new low vision program. It's been almost 2 years old now, as we find that since so many of our clients are older, a lot of them vision starts to go, other illnesses. So finding ways to keep them living independently is much more difficult. I wanted to cite a couple of statistics, and I think last year I did the same thing. The Population Reference Bureau, and I've seen pretty much identical statistics over the last few years, predict that 58 million, the 65 and older crowd in this country will grow to 58 million in 2022 to 82 million in 2050. That's 25 years away. That's a 47% increase. we know that in Prescott, the 60 and older crowd is already half the population. All of the Quad Cities is it's double the national rate. So we expect to see a lot of that population growing here locally as well. So that's our biggest concern, is how, not just just transportation, but services in general, to keep the older crowd, who are living much longer now, keeping them. How are they going to access health care? How are they going to get groceries? How are they going to, socialize with people, that sort of thing. So we're concerned about that. We know we're pretty confident that the types of services that we provide, which are escorted, we do the door-to-door thing, are going to be in great demand for quite a while to come. Thank you.
I'm Kathy over at the center, and we mostly service seniors, even though our membership is open to 18 and over. This year, we've increased our membership by 50%. Half of those people are actually free members who can't afford a membership, and they use their insurance to receive that membership for free. And a lot of them come to classes for fitness, education. We do Medicare seminars. We're right next door to Meals on Wheels, so when they come visit us, they also usually eat at Meals on Wheels. We partner pretty great that way. I know that we would have a lot more members we could service if they had transportation to our place. Meals on Wheels could feed them, and then they could socialize and play games and stay active and fit. I know that for us, a lot of people miss the socialization during COVID, and Meals on Wheels lunchtime is like everyone has their own groups, and if someone's missing, they know it. But we keep them active, fit, engaged, and educated. We have, like I said, half of our members are on free memberships, so we offer scholarships to those who can't afford it. And we also do classes and rentals when our seniors aren't there. So on the evenings and weekends, to help supplement our income to provide those classes. And a lot of our teachers will teach classes for $1.50 a student. So if they only have 4 students in their class, they're not even making minimum wage. So we've struggled a little bit with adding more classes with our increased membership. And also, like, a struggle overall is staffing. It's really hard to find someone to come and work, which is surprising when everyone seems to be looking for a job. But I know that's been a constant issue all year for us. So that's just like a little overview of what we're doing. We have a huge need of tables and chairs. They're all about 15 years old. We generally need 600 chairs to have all of our rooms fully functioning, and we're down to 300. We lose about 2 chairs a day, and they're about $30 a chair to replace. So right now, that's our biggest need, in addition to instructors and staffing.
Well, I want to thank the committee for your time and volunteering, and also for being, as a past recipient, being able to help cover our food costs. It's been a tremendous support to our organization. And I'm here simply building on the history, our 51-year history of serving Prescott and Prescott Valley over the last 8 years. And like all the other nonprofits and social services, we're experiencing record growth. Where we've outgrown our building. We work closely with Kathy and doing everything we can to get creative on storage space. But we've served over 100,000 meals, of which 48,000 here in Prescott. So with that, our kitchen does not have storage space. We've had a donor who's come forward and paid for our initial schematic plans. And so we do have a rough idea of how we can expand and triple our kitchen capacity to 300,000 annual meals. And so I want to thank the city for their help as we've navigated the very early stages of that process. But that will be the easy part. The hard part will be us organizing a grassroots effort to raise several millions of dollars for a capital campaign to fund this new kitchen that will really serve us for many years, we hope, at that 300,000 mark. So we'll be submitting for some sort of construction assistance, and likely would follow the model that the senior center in the town of PV did of rolling over the funds and using them over a couple years, as we're, again, in the early stages. So it's going to take us some time before we can actually construct and just tons of planning. We're built on the backbone of our volunteers. We have 246 volunteers that care for the homebound, that deliver not only a warm, hot meal, but it's the companionship. And there is isolation is the worst thing for your human spirit. And so many of the organizations here, they have that common thread of just being able to serve someone that's homebound or vulnerable and knowing that someone cares about you in the community. And that's the great thing about our community. There's so many volunteers and people that want to give back, and they do with everyone in this room. But just want to acknowledge that social isolation is really the worst thing, even beyond the food. Thank you.
So the last time I was here, I was a project under Community Counts. I shouldn't say me, but the Wrapped in Love Diaper Bank. Since then, we've achieved our own nonprofit status, and this past month distributed over 8,400 items. We distribute diapers to several partners, incontinence supplies, and period products. We also have a potty training kit, and we provide that when the children are ready. And we distributed toothbrushes in October, and we'll do books in December. So we've really grown as a project. As a matter of fact, it's 144% growth from last year to this year in the first 6 months. And we continue to see the need. And as they described, we have more elderly that we're providing items for, because all of these items are free. All of the programs are delivered through a community organization, so they get the wraparound services from those other agencies. So we do not provide directly, but we raise funds to get the products and work on purchasing them bulk. So having funds for the products so that we can continue to scaffold our growth, because as many of you probably know, we have over 1,300 kiddos 0 to 4 living in poverty in our county, and over 9,500 elderly living in poverty in our county. So the need is there, and we work a lot with the homeless liaisons at the schools for the feminine hygiene products, which go to older students and the parents, and we work through the nurses. So our whole goal is to provide clean, to provide an opportunity for clean, dry, healthy folks, and then that equals happy families. And then we know it reduces stress and the trauma in the households, etc. So thank you.
Questions? Debbie?
Does New Horizons provide physical transportation to those in wheelchairs? And
Yes. Yeah,
and
that's a lot of what we do provide.
and people who care do not, right?
We do not. No.
Thank you.
I have a question for Neil. You're in a design part, which is a capital thing for this kitchen?
Correct. Yeah, we have not. We've gone through the city process, the PAC, and that's been approved. And now our architect is working up the construction documents, and then we'll put that to bid from 4 to 5 contractors, and then we'll have an idea of the full cost. But we've also been working with a kitchen consultant on designing the equipment list, designing the concept and everything, and that's all completed.
A question on Meals on Wheels. That's a big project to build a new facility at a new location, I would think, or next door.
Oh, and I know it's going to be in addition to, it'll be about 1,700 square feet, an add-on to our existing space. And so we, our existing cafe and kitchen and office space, we've just outgrown. So we are able to just add on to that footprint. It will be a significant investment. We've been very encouraged. It's been very grassroots. We've never planned a capital campaign in our 51-year history, so we don't have that to pull upon, that organizational knowledge, so it's taken us a little bit slower. But as word has gotten out, some partners have stepped forward and had some leadership gifts that have been very encouraging. And then we've actually have been encouraged by the town of Chino Valley, their success, a little bit different model as far as funding, but how they were able to plan that and do something really special. And Pine Rock, we just were talking up north, and they just redid their senior center, and their community of 16,000 was able to raise like $2.5 million. So we feel like we have a great story to tell, and stay tuned.
Good. I'm glad that it's expansion and not a new location, because I think it's a good kinship with the Rosser Center, and which brings me to Kathy. Kathy, last year your organization was a recipient of some CDBG funds. What's the status of that project and the allocation?
Yes, thank you for that funding. We're just waiting for a contract from the city, and we're gathering the final bids. We did change the plan a little bit to include Meals on Wheels. Since we have the space, we could make it larger and actually give them a portion of the building to use for their much needed storage. So we're going to partner together on that to allow for a larger building in the same space. We're very excited about it.
Okay. We thank you. Appreciate you coming in.
Thank you.
Okay, the last group is other public and health services. Basically, if you hadn't had a chance to come up to the table and speak, this is your turn here. Agape House, if you would like to come up to the table as well. So I have Northern Cares, NASCare, Polera Health, youth programs of Yes, First Things First, Launchpad, and Arizona Serves. I don't know if Arizona Serves is here. Okay. Again, please keep your presentation to 3 to 5 minutes. Allow time for questions. And let's start out with just going down the table, introduction, and what organization you represent.
So I shouldn't have sat here, right?
You're first.
All right. Hi, my name is John Duncan. I'm with Northland Cares, which is an organization that's been in Prescott for the last 20 years that's providing HIV and AIDS care for people that are experiencing the effects of being HIV positive. We do testing, prevention care, and we also help out with housing and any medical needs that they would be able to assist with. That has also included us to be able to increase our services because now we just hired a nurse practitioner that's going to be able to assist people that are not HIV positive, but be able to help them and assist them in high-risk situations. We also have a mobile unit that does testing countywide, and being able to go to testing events and partner with other public events to be able to provide free testing throughout all of Yavapai County. Our housing through HOPWA provides services for housing for 5 counties. So not only do we do it for Yavapai County, but we do it for additional 4 counties to be able to help them, and also on the Indian reservations. We have also done a investment into a hotline that assists people that have any type of accidental exposure. So this could be someone that is in the medical field that had an accidental needle prick to someone that just experienced a sexual assault. They call the number, we get them tested, and we get them on the medications that prevent them from being infected up to 99%. But the problem with that is that it has to be within the 72 hours of the accidental exposure. And we have not had anybody show up positive going through that program because it is a month-long regiment of medications that have to be taken daily. Those costs alone can be $2,500 to $3,000 a month for medications. And our primary goal is to help out with the medication purchases and the medications to be able to assist in people being, and it's called U equals U, which stands for untransmittable and undetectable. And that is the national program to be able to assist in people not keeping their health up, but also not being able to infect anybody new. And that's what the medications provide. We've worked really closely with with CCJ and with other organizations to be able to provide testing for people that go to their shelters. But the problem is that with the HUD funding that we receive, if we have a specific person that does not have a permanent residence, so like for instance, if it's a house unit that is on wheels, we cannot spend the HUD money on that. So like for instance, if they need propane to be able to pay for heating for their unit or anything like that, we would have to come out of unrestricted funds to be able to do that. And it gets up to maybe $40,000 a year for us to be able to come up with helping people with moving costs, helping people with deposit costs for staying in their apartments. Because when you end up finding someone that is HIV positive and they just got tested, it is a shock to their system. So we provide the mental health to be able to, because suicide ideation skyrockets as soon as they end up showing up and being positive. So we have to get them mental health assistance. We also have to be able to get them on a regimen to be able to bring down the virus count to be able to bring that down. And then we would be able to assist them to be able to make sure that they're able to stay in the housing that they have if they are housed. But there are a specific population that is unhoused that we will be able to provide and help out with those services. And we also do prevention care. As I already said, we have a PEP and PrEP navigator that basically helps out those that are at high risk to be able to prevent them from being infected. So they go on to a regimen, even though they are negative, to be able to do that. And also with the innovative medications, there's called DoxyPrep, which helps out with non-viral infections, so like bacterial infection STIs, that's available to us now, and that's why we're investing into a nurse practitioner to be able to assist those and everybody in Yavapai County. Sorry, I may have taken too long.
Go ahead.
Hi, I'm Sean Sumilis. I'm the Program Coordination Specialist for First Things First. First Things First is Arizona's early childhood agency and the only public funding source for early childhood and the beginning of our state's education continuum. My role as Program Coordination Specialist is to create family support systems change in the Yavapai region, which is part of a larger systems change effort that also addresses children's health and engagement with families. This is done in collaboration with NAU, YCCHS, Violas Health Foundation, Chicanos por la Casa, and other community partners. FTF is not a program. However, we do facilitate and invest in proven programs and innovative strategies through grants to community organizations that provide services to children and families. There are 28 FTF regions in Arizona, and each region has a volunteer regional partnership council that it governs how early childhood funds are invested in strategies that will result in improved education and health outcomes for young children in the community. Per the FTF 2024 Yavapai Regional Partnership Council Needs and Assessments Report, prepared by the University of Arizona, there is a need in our community for access to affordable quality childcare. There is a gap between the number of young children in our community and licensed childcare spots. While Yavapai County is not a childcare desert, we are a childcare desert for infants and 1-year-olds. For every 16 infants, there's only 1 slot, and for every 5 1-year-olds, there's only 1 slot.
The average cost for childcare in our community is $8,500 per year. I know someone that's spending over $2,000 on her 3-year-old twins, which is more than her mortgage. The cost of childcare in Yavapai has continued to go up since 2018, with the average for our community being higher than the state average. Consequently, the cost of childcare is rising at double the rate of inflation. Also, the poverty rate for children in Prescott 0 to 5 is 11%. The lack of affordable childcare significantly impacts our Prescott economy by reducing workforce participation, damaging productivity, causing absenteeism from work, and ultimately leading to lost revenue for businesses, all due to parents needing to miss work to care for their children when reliable childcare is unavailable. The solution to the childcare crisis in Prescott is multifaceted and encompasses collaboration between elected officials, schools, families, and businesses in our community. This can look like launching an initiative to increase childcare capacity or creating a community coalition for childcare. There are communities in the U.S. who have used CDBG funds under public service for childcare in their community. Jefferson, Missouri used CDBG funds to help low-income families with childcare expenses. Here in Prescott, we are asking that CDBG funds be used for childcare subsidies for 10 families. That would be $85,000. I know there is a lot of consideration about infrastructure. There's a larger conversation going on in our community as we have grown. Childcare is infrastructure. Supporting our youngest Prescott citizens and their families will help to lead to a more thriving community through economic growth, improved child development, and improved socioeconomic outcomes. Thank you.
Good job. I do want to say that childcare is a big problem in our area. I'm going to support that for just a minute because our families would not be homeless if they had childcare, right? So thank you. You were very encouraging. I'm Becky Mitchell from Agape House of Prescott. We serve families overcoming homelessness. We provide discipleship, mentoring, life skills training, interim housing, and utilities. We believe the solution for homelessness is the pathway to independence. This is a 4-phase program starting with stability, which means basic needs, and then personal wellness, including holistically physical health, mental health, emotional stability, and then phase 3 is life skills training to never be homeless again. They need employment, career coaching, budgeting, parenting classes, time management, home organization, which leads to sustainability. Sustainability means they have housing, affordable housing, they have employment. They also need sustainable childcare, and they need sustainable transportation. So this is all-inclusive programming. It's not just a Band-Aid, and it's not just a one-size-fits-all. Our vision for Agape House has been, we just completed our 9-unit apartment complex, which we're very grateful for the renovations funds that was provided through CDBG over the last several years. We are expanding into Prescott Valley. We have 6 more units going out over there. That should be completed on December 21st. So we are interested in understanding where the vision will be for January of 2025, but we want to see both of those completed by the year end first. We are able to identify close to 230 students who are homeless in the Prescott Unified and Humboldt Unified school districts. So there definitely is a problem, and a lot of it is because of affordable housing. So we are trying to work with the city, other partners. We need to be creative at how we find housing for our families. We are Agape House of Prescott, serving families in crisis. Thank you.
Hi, I am Greg Billy. I'm the CEO of NASCARE. We are a nonprofit organization that serves adults with mental health, substance use, and co-occurring issues. Our population is a low-income population. We do serve people throughout Arizona. Our mission is to provide hope and healing and to help people reclaim their lives through a community-based approach. Here in Prescott, we operate both the New Hope Wellness Center and Hope House, which are located on White Spar Road. These two facilities work hand in hand, providing a comprehensive support system for our community. The New Hope Wellness Center serves as a hub for peer support, recovery programs, and wellness activities, including transitional housing. These are both group services and one-on-one services, which include family support, reducing social isolation, life skills for independent living, connecting with resources, community outings, providing meals, transportation, and an array of programs. In addition, Hope House, located directly behind it, also offers transitional housing with wraparound services for our population. Together, they create an environment to help people gain independence and develop life skills. The ages of our population are from young adults to seniors, so it's a broad range. And we support, I think, the community and people both ways, not just the individual, which has the needs for the support, but also the families. A lot of times we have parents that have an adult child, which they really need help with, so they come to our services. Or we have, of course, children, adult children that need help with their senior parents. And we also, a lot of times, if the parents, have passed on or whatnot, we have siblings, brothers or sisters that need help with their other family members that we serve. So the need that we serve is both day services and transitional housing, which is we're kind of unique because it's integrated. We're about programs, and we're about helping people gain the skills to be independent, but also maintain stability, because stability is really important. How does it help the need in the community? Well, it keeps them out of crisis. It keeps them even both mental crisis, because we're behavioral health, but also physical, because we work with a lot of their physical health as well. And it, again, helps by also supporting the family. The historic building on White Spar Road and our other Hope House are more than just facilities. They provide a real value for the people we serve, and provide a safe space for countless individuals over the years. Unfortunately, time has taken its toll, and now restoration is needed to help with some of these buildings. We have received a grant already. It was about $90,000 for a lot of interior remodeling. That project is on track. It's on budget, and it's been very helpful. However, we are looking for more to the parking lot, for example. It's really not safe. It needs work. It needs to be fixed. The stucco, the building itself needs repair. The roof needs to be repaired, inside wiring. And that, again, allows us to provide a facility to not both house or provide the day services, and the people that we serve come regularly. I think if we weren't able to provide this or didn't have a facility to do that, it would really hurt the community. So I think it's really important. And we do have figures, of course, for what we would need for the second phase of the project, but I just didn't know we needed it here. I would also like to say just what is with our funding? Why do we need some of this funding? Access has had massive changes this year. I don't know if anyone's familiar with behavioral health. There's been massive amounts of fraud, whatnot, but they're changing how they operate. There's been major mergers with health plans. There's been a lot of changes that affect our funding. We do not have the extra funds to do this work. We really don't. And right now, with all the changes going on, we're just, want to maintain our services and be able to do what we can, including, again, all the transportation and everything else we operate. So that is one of the reasons why we need the funding, because there are a lot of changes now that are making things tighter and more difficult for us to fund ourselves.
Good afternoon, everyone. Thank you again for this opportunity to speak with you today. My name is Kiana Nabor. I'm the Community Outreach Coordinator and the General Manager for the Moon Cafe at the Launchpad Teen Center, and I'm here speaking on the behalf of the Launchpad Teen Center. The Launchpad is a nonprofit organization and youth-driven space dedicated to providing an inclusive and safe space for teens to thrive. We offer various leadership opportunity workshops, after-school programs, and internships designed to prepare them for the future. As a part of that mission, the Moon Cafe serves as a unique social enterprise where teens gain hands-on work experience while serving their community. One of our urgent issues that we face is the financial instability of many of our youth that we serve who fall under the ALICE threshold. In Yavapai County, this represents a significant portion of families, about 42%. To help address this, the Moon Cafe's All Access Pass program provides free meals to teens during drop-in hours and delivers school lunches to North Point Academy and Skyview as well. We also provide some lunches that are picked up by students for PHS students. Along with a healthy snack option and the meals during drop-in hours, this program is continually growing. Right now, we are currently serving 140 teens weekly. That's a little bit under 1,000 meals a week, and that is growing every single week. Along with the number of increasing teens, the meals are also growing, and the needs for transportation are also growing at the Launchpad. We currently have one 15-passenger shuttle. We've fortunately been able to secure a donor for a second shuttle, which will expand our reach to serve more teens in Prescott and the Quad City area. This additional shuttle is in high demand as we currently serve an average of 49 to 70 youth each day in our space, and our existing resources are stretched thin. However, we need a match donation to make this opportunity a reality and meet the growing needs of our community. A new shuttle would be about $60,000 for an ideally a 15-passenger shuttle. Our current shuttle is used and costs about $27,000. We are looking for a used shuttle as well. And lastly, I just want to emphasize that every investment in our program directly supports the well-being and development of the local youth. Your support helps us foster a future where every teen feels safe, supported, and capable of success. Thank you for considering our needs of our organization, and together we can make a lasting impact on the youth in our community.
Questions? I have a couple, and I'd like to start down here at the end with the Northern Cares. Mr. Duncan, you're applying for X amount of money for what?
So we do housing, we do prevention, we do multiple different points. It just matters on the restrictions of the money that we end up getting from you of where we're going to be spending the money. The amount that I said, which was the $40,000, would assist with housing costs, with moving costs, with anything that is not within the federal money that we would be able to spend would be the money that we would spend through the grant that you would be able to give us. It's basically helping people, like for instance, this last year, we helped someone get cooling and heating into their house, and that cost $10,000. That keeps that person in their home. It gives a chance to be able for them to focus on their health, which lowers the chances of having a new exposure, or for their health to be able to waiver, because you're talking about someone, okay, am I going to spend the money on medications, or am I going to be spending the money on staying in my house?
Okay, first things first.
Yes.
You're coming to CDBG for X amount of money for what?
It would be a child care subsidy. So at $8,500 is the average cost per child. So we're asking for 10 subsidies.
So it's just a subsidy.
Just a subsidy.
Okay.
Yes.
Agape?
We're looking for programming funds for our after-school program, for classroom materials, payroll, and equipment for outside for the after-school hours from like 3 p.m. to 7 p.m.
Thank you. NAZ?
Yes, funds for roof replacement, parking lot repair, stucco, yeah.
That's right. I did write that down. And launch pad.
We would be asking for the All Access program. It would be about $12,000 to cover our estimated costs for the coming year.
And again, the dollars are out there. It's a project that you have that you need the support for.
Yes, for the All Access program, which covers snack of the day, our meals that are for teens after school, and then also the ones that are delivered. And it could potentially help pay for some of our labor costs as well. We also are asking for a match donation for a new shuttle.
Okay.
Yes.
All right. That took care of mine. Anybody else? Mike, I think we'll pass that on to you.
That is it. Thank you so much.
Thank you.
That was the
Thank you.
last group. I appreciate everyone that showed up and presented, and thanks again. So
Thank
have
you.
a good week.
Appreciate each and every one.
All right. I have last slide. Well, this was a public hearing, so officially we have to close the public hearing. I put the wording up on the screen for that motion.
So staff announcements will wait.
Right after this, after we close the.
So we're going to adjourn the CDBG Citizens Advisory Committee today, the 20th.
I'm sorry, Madam Chair. Just a motion to close the public hearing, and then we would continue with the meeting.
I'll just read it off the big screen.
Yes,
How would
ma'am.
that work? Motion to close program year 2025 Community Needs Workshop and Public Hearing. I have a motion for the books. Who moved?
And I'll do a third.
We'll take it. That's been closed.
That has been closed. Would you like me to close the doors? No, it's fine. So the public hearing has officially been closed. Okay, all I have is quick staff announcements. Our next CDBG meeting is going to be in December 18th. Any issues with December 18th? Okay. Anybody else that?
Why are you having this in December?
The reason is because it's the 5-year consolidated plan. There's stuff to talk about. If we can't do it, not a big deal. But I would think that a future we might have to double up at some point if it gets really busy with the consolidated, or have a longer session in the spring.
So can maybe we decide if we can't make a quorum in December, then we move on to January, February, March.
Do you want me, because last year we didn't make the quorum, which wasn't a surprise. Do you want to go ahead and cancel the 18th, and I can just make sure?
I'm going to ask this board, this committee. How's your commitments for December?
I already have the meeting already on my calendar.
Okay, you're set. You're not. And Debbie, and you attend?
Yes.
Well, then you have a December meeting if everybody shows.
That'll be great. And there's going to be stuff to talk about for sure this year. That was my big staff announcement. Anything for me? Yes, ma'am. So the next step is I have to do the minutes for the meeting. I can send out a list of everybody that spoke. And if you want to send and then just respond to that email, just a list of.
Because for me personally, a couple of the questions, if we would have had more time, I'd like to know other funding sources that they have. I'd like to know funds that they've received so far for the proposed, items, and specifically what they're asking for, not just a generalization.
Right.
So amount what they're asking for, what they've received so far, what other funding sources they've attempted, and then the amount
Mm-hmm. Right.
The reason we curtail the amount is it is a public meeting. When that's quoted, someone else might think, I don't need to come in if they want $300,000. Why am I? Mike, we can't hear them.
Oh, make sure to press we're still in the meeting, so if you could press the speaker button.
Sorry.
Rob just yelled at me, so.
So what we were trying to do was just get what they were applying for. And so aren't we going to have one more meeting with them?
It's going to be in the spring. We're going to figure out what that's going to look like, if it's going to be the same format or maybe it's going to be more of an open house kind of situation. I mean, we heard from a lot of stakeholders. There's more out there. Again, if anything, this is meant to, hear what the needs are. I wasn't expecting everybody that showed up was going to be applying for CDBG funds. If that makes sense.
Test the water.
Some of them might not be this program year, but the following program year. So it's just getting their organization or their project on the radar.
Push a button, Ginger.
Yeah.
Sorry, just because of the Meals on Wheels, their building is going to be in the future.
Mm-hmm.
So something like that, they just want to get on the radar saying that we're going to be doing this
Right.
building. And yes, they're going to be asking for funds, but in the future, they're going to be asking for funds for that building.
I would be surprised if they're able to get everything. The application period opens December 15th and closes on the 30th. I would be surprised if they have it all ready to go by that point for this. Yeah, for us.
Real quick, design. Help me. Have we always funded money for a design project?
So there was two that were a little bit different. First, the public works. They're asking to pay for a study, which you heard can be pretty expensive. We can use CDBG money for that, okay? And the reason for it is because that study is meant for a project in an LMI area designated by HUD. Yes.
So which fund does it come out of?
It comes out of CD.
Construction?
Yes.
Oh, okay.
It would be
'Cause
part of that. It wouldn't be public service. It would be
Okay.
part of the public infrastructure project. So that side of it.
That
And
makes, otherwise.
Yeah. So
From my observation, Dexter has always been an issue. I mean, I frankly think that you don't have anything really you can do except put a straw in a street to get rid of all that water. But since 2019, and they've been working on this, I would just think that there's so many needs that could be done. That was just my observation. That was kind of a stretch. And then the other one was the Meals on Wheels.
The Meals on Wheels.
Let me try and respond to that, Ginger.
Oh,
in Public Works, they live in a.
do you have the mic on, Jim?
Is that better?
Yeah, I think so. Yeah.
They live in a 5-year world. They have a whole list of projects, and different steps occur across a period of 5 years if they're lucky. And then sometimes they'll have a project on that list for 10 years, but it never gets funding. But I'll tell you, and I've been project manager and spent lots of CDBG funds, but I am especially fond of projects that put sticks in the ground, pipes in the ground, and we get something we can see and point at.
You see,
and engineers, I love them. I've worked with them all my life, but they have endless studies, and
they're very
and
expensive.
it's like, why didn't you get this right in the first time and be specific and get plans specific? So I wasn't sympathetic.
No, and 5 years later, and here they want another study, and it's like, and I get that. I understand
changes.
that, but there's other funds for that, FEMA funds, I would imagine. No?
No, I've never spent a dollar on storm drain improvements. They'll fix something that's broken, but they won't improve. But there should be some storm drain funds. It's an enterprise fund by the city that's
That's what I thought too.
just like water funds, and there's wastewater funds.
So I'm sort of thinking the next time we get a presentation from them, if you can hone in on what you want them to say or do for here, because again, Jim had issues, Ginger had questions. We'd seen some of it, couldn't quite answer all.
Right.
But there's a lot of questions that haven't been answered.
Absolutely. I'll get that list together, and those questions I'll be sending.
I really like the idea that they provide us something.
Well, how was this format?
Great, but it's hard to keep notes of everything. So
Yeah. I almost put name tags up for everybody, but that would have been.
No,
There's a lot of changing names. A lot of people are in and out of showing up.
And they know each other.
Yeah.
I mean, the point is, and they support each other. They're here for a certain reason for their organization. I think I counted 5 different requests for transportation. I don't know how we're ever going to settle that, but each one comes in for a reason. Okay, we're all set with that.
I wanted to go back to you, Michael. You had
Yes, ma'am.
said workforce housing, but we didn't hear what you're looking for also, so that's thing 2.
We're sorry we forgot you, Michael.
So no, that's completely fine. Workforce housing, really, I just wanted to get it on the radar. It is very slow moving in committee and what the committee and the city is able to do. There are ideas regarding CDBG funding. For example, if there was a workforce housing development, CDBG money could be used with the infrastructure of kind of plumbing or connecting it to the city. The other thing to consider, and we've never done this before, is we only get about $250,000 a year. However, HUD is really pushing for those bigger projects, combining 4 to 5 years at one time. So instead of the 250, you would have 1.2 million to put towards a bigger project. It works as a loan, okay? And there's some strings attached to that. But if anything, the workforce housing was just to get it on the radar and record it so we can include it into the 5-year consolidated plan, if that makes sense.
Until now. So
yes.
So when you're also getting the information from all these people as to what all those questions I ask, can you also get websites so that you can get them to us so we can look up specifically?
Yes.
And then is there an opportunity for people who did not come today still to apply before December 5th?
Absolutely. Again, this was only the first step, and an applicant didn't have to show up today. Everybody's going to be made aware of when the application period opens. So there's a lot that didn't show for whatever reason. I was in contact with Prescott Area Shelter Services. They were at another event. They were going to pass along a letter for us to add to the public hearing. So.
If you know of those other organizations that weren't here, could you also reach out and add that when you do that follow-up with us? Because then
For sure.
we in our leisure time, could look at those sites and then kind of look at that information and kind of get an idea so that we're a little bit more prepared.
Yes. Yes, ma'am, I can.
Just a comment. I think about, we only had $70,000 to give to people but the construction was 130, and we only had 2 people to give it to. So again, you look at all the people that we heard needs from, and we're going to have to really again pare it down to 3 or 4.
The mic. Sorry.
I think looking at where they've gone for other funds and what funds they've received.
That will be provided to us.
Yeah, that will help us.
Yes, for sure.
Yeah, help us make those decisions because if they haven't, if they're looking at the.
And I support what you're asking for, Ginger, but I'd like to see it, say, a one-page so that each of us get this piece of paper that's got a very brief description, the things you were talking about. So when every speaker gets up, we go, this one, because it was really difficult to track.
Yeah,
and I'm not familiar with most of these nonprofits, and I was going crazy with it.
Yeah, there's a lot of need, that's for sure.
All right, Jim, you and I had a sidebar meeting before the meeting started with CDBG. Connect with Michael and tell him what you were discussing.
Okay.
Once that money.
Just real quick, I was disappointed after the last meeting to learn that all these recipients, a number of them, have carryover funds. They've never spent the money, and it's like, well, did you really need it? And there's been limited communication between the groups and the city. So I'd like staff to develop a form to ask for an annual report from them saying, what's the status of my allocation? What do I see in the future? When am I going to spend the money? So we've got a better pulse on this.
But
what I can do is I can just make it standard operating procedures, bringing an update to each meeting, do it during my staff announcements, just throw up the spreadsheet of this is where we're at with each project, what their current balance is, what's been expended.
But I'm not trying to make more work for Mike.
Right.
I think this is for the recipients.
I already have it. I have it. I mean, I can just and we can highlight. If there is a subrecipient that is slow for whatever reason, it just pulls your attention to it. You'll see. I'll make it pretty user friendly.
Can't you take the funds back after a certain period of time?
So they have, for construction projects, they have 3 years to spend the funds. For public services, a year. And usually it takes, about a year to get going with some of these construction projects. The reason for that is we just, like everything that we approved in March, right? We just got HUD approval about a month ago, a little bit over a month ago. And then with the next step with infrastructure project is the environmental review process, which luckily this year doesn't look like it's going to be that bad. Then contracting, and then we can start going with some of these. For example, Kathy McFadden with the center, they're almost ready to go. I'm in the process of doing an environmental review on that. That was the shed. And then contracting, and they've been working with our building permit department, getting everything ready to go on their ends. Yeah.
You have to do an environmental impact on a slab?
Yeah. Every construction, but it doesn't, not an environmental assessment. It's a lower level. So if it was, and that's, we don't have to hire out for that level. If there's, right, yes, yeah. But if it was a major project, yes, we would do the whole environmental assessment. CDBG money would probably be used for that. That was the problem with the vets officer quarters. But we're good, like a miracle. It's been over 2 years, and HUD has released the funds. Vets can get their appliances now. It was a nightmare, but that was an environmental review nightmare, like you're saying.
And again, it's not us dragging our feet. It's HUD not funding. We've done our job.
Last thing, when U.S. Vets offered a tour, I would find that very interesting. To that place and to anyone of the others that felt like we need to put eyes on what they're talking about if they had a specific project. I think that would be an interesting tour.
Absolutely. I can arrange that for sure.
But wasn't there an issue that that if more than one goes, it then becomes a meeting and then has to be publicly posted that we're doing those site visits?
Thanks for sharing that. It is 3. 3 can go at a time. Oh, the mic too. Sorry.
Sorry, if you just get us, if the organization just offers us to contact Bill Smith to schedule an individual tour, then, if we have the availability, then I take it upon myself to go look at those.
Okay, absolutely. All right. Meeting adjourned. Okay. What's the time here? 3:19. Okay, thank you very much.